We all have our healthcare stories. Mine started in 2006 when I was diagnosed with breast cancer. I had just left a job that wasn't as rewarding, and I'd always had an idea to start a small town community newspaper. And I was on the verge of putting out my first paper when I was diagnosed. And I had enough of a healthcare plan left to handle surgery, but after that I lost my health care and I went 5 years without health care. At the time, I did something that a lot of people don't feel that they could do. I had the option of staying with my job because of health care or following up on my plans to start the newspaper. And I took that big leap off the wall and started the newspaper knowing that I wasn't going to be able to afford health care because pre-existing conditions at the time priced me out of the market. And so for 5 years, I knew that at any time, if I had a health care incident, that it could sink me and it could sink all the work that I was putting into to start a business. And my risk paid off, it worked, but for so many people who are raising families or who can't afford the risk that I took, they are stuck in jobs, they're less mobile than they'd like to be, they don't feel like they have the options that they would like to have. And so affordable health care is really critical and something that as a candidate for House, I'm going to work really hard on supporting the ACA because it was the foundation that eliminated the pre-existing condition that allowed people like me to get health care for the first time in 2011. But it's got issues and we need to work on fixing those. Not the least among them are high drug costs and accessible services and programs in rural communities like the ones I'll represent. So it's going to take a lot of hard work from all of us on both sides of the aisle, but affordable health care is critical to our own lives and our dreams, as well as our families, our communities, and the economy of our state. So I will work hard on health care.